I think we need to use them as a tool to get ourselves into a healthier state. And then we can maintain that with the common sense of diet and exercise and taking care of our bodies. If you look at patients or populations that live to 100, such as in the blue zones, they're not taking semaglutide. They are active people. They're eating healthy, primarily plant-based diets. They're connected with their community and have a spiritual life. Those are the keys. Hi, I'm Dr. Christi and welcome to the ChristiMD podcast. I'm the founder of LifeSculpt by ChristiMD, a practice dedicated to longevity medicine with a foundation of intimate wellness. We believe that intimate wellness is essential to wellness in general, and we are pressing into that with incredible technologies, surgeries, and hormones. But we're also very comprehensive. We're looking at the whole person, and part of that is metabolic balancing. So today I wanted to talk about weight control and metabolic balancing and really take a deep dive into GLP-1s and what they are, who's a good candidate, and what we are doing with them in our own practice to help people to manage their weight. Now, I know for myself that I have noticed my weight going up and down over the years. It seems that I gain and lose the same 10 pounds over and over. And I've had periods of time where I've gone up 20, 25 pounds as well. Hormones have been very helpful for weight control for me. And fortunately, with my diet and exercise habits, I've been able to stay pretty steady. But I know that talking to a lot of my patients, there is a struggle to really get over the hump sometimes. And sometimes we need a little boost, a little reset to help our bodies to lose that extra weight. Now, it's not only important to lose weight for our vanity, because we want to look good. We want our clothes to fit better. We want to feel good and be able to move around. That's very important. But it's also very important for our health overall, because when we're carrying around a lot of extra fat, that is really putting a strain and stress on our entire body. And let me tell you what I mean by that. Of course, we understand it puts a stress on our joints, on our knees and our feet, our hips, our back. That's all very stressful. It also puts a stress on our pelvic floor. Puts pressure down on the vagina where things can start to drop. We start to have more leakage issues, which is something I'm very dialed into as a urologist. But also metabolically, all those extra fat cells, when those fat cells are turning over and the cells are naturally dying and then regrowing, every time those cells die, it creates an inflammatory cascade. And that inflammatory cascade is what really damages our body. It damages our arteries and damages our brain cells. The liver has to go into overtime to try to process all this extra carbohydrates and fat that we're eating. It strains our kidneys. Every part of our body is affected when we're carrying around too much weight. So it's not just to be skinny, it's to be healthy. And when we're healthy and we're active, we're going to love our life more and we're going to live longer and enjoy it longer and be able to do the things that we want to do. So there have been many trends over the years to lose weight. I've been through all of them: the no fat, the no carb, the keto, all the different variations, vegan, vegetarian. I am vegetarian. I've did veganism for a while. I prefer eating plant-based, and I think eating primarily plant-based is the healthiest way to feed and nourish our bodies. And one of the latest trends that is out there is GLP-1s. So this is Ozempic, Mounjaro, and the generic names are semaglutide, which is the generic version of Ozempic, or terzepotide, which is the generic version of Mounjaro. So I want to tell you all about these medications. We are utilizing them with our clients with great success. And I want to tell you kind of a framework for how I think they are best used. I have seen many articles lately about these medications and projections of what the government and what the drug companies are expecting these medications to do. And they are literally expecting the growth of these medications to just continue ad infinitum, well, that indicates that they are projecting that we're going to continue to have patients that are obese and have diabetes, and they're going to be on these medications for life. Personally, I don't think that's the best route to go. I think we need to use them as a tool to get ourselves into a healthier state, and then we can maintain that with the common sense of diet and exercise and taking care of our bodies. If you look at patients or populations that live to 100, such as in the blue zones, they're not taking semaglutide. They are active people. They're eating healthy, primarily plant-based diets. They're connected with their community and have a spiritual life. Those are the keys. To depend on a medication like this for life, I think, is an error. Some people may need that for their diabetes, but I really want to help patients to not have to be on this forever. All right, so let's back it up. What are GLP-1 inhibitors? How do they work? Well, they were developed to treat type 2 diabetes, and now some of them are approved for weight loss, and some insurance companies will pay for it. A lot of them don't. I know from personal stories of people I know that actually have diabetes and were prescribed these medications, that they can cost upwards of $1,200 per month for these medications. So they're very expensive, and they require a once weekly injection. The way that they work is a couple of different ways. They slow gastric emptying, they reduce sugar cravings, they help your body process the carbohydrates and sugar that you're eating more efficiently. And because they decrease your appetite, it quiets some of that food noise, the stress eating, the bored eating, the social eating, where you just kind of get in the habit of eating all the time. So it helps you break that habit. I think that they're very useful in that regard. Now, GLP-1 is actually something that our body makes on its own. Our intestines are making GLP-1s. The problem is that sometimes that gets out of kilter because we're not eating healthy diets. Our intestines, our guts are not healthy. And so the cells that are supposed to make the GLP-1 are getting barraged with all this waste products and toxicity, so they cannot make enough of the GLP-1 naturally. We're actually using a probiotic now called Akkermansia, which is very good for healing the intestines and allowing them to create their own endogenous GLP-1 again. So that's a very essential part of the journey as far as I'm concerned with my clients. So these medications can have side effects. For the most part, they are mild and manageable. They can be quite bothersome for some people. The biggest side effects are GI. So because they're slowing the gastric emptying, the patients may experience some heartburn, indigestion, some stomach or intestinal pain, constipation, or even diarrhea, nausea, and vomiting. So these can be managed with decreasing the dose or adding in medications temporarily to allow the patient to get over the humps, so to say, with these symptoms. Most of these symptoms will resolve pretty quickly over time, within 2 to 3 weeks. And then the body begins to adapt and get used to it. We change our eating habits and we're eating healthier so that they become not as noticeable, and patients can continue the medication. There are, of course, a few patients that just cannot tolerate it. Neurologically, it can, because you're not eating as much food, it can cause headache, fatigue, lightheadedness, until your body gets used to being at a lower calorie count. Also, a lot of the diets, the standard American diet is actually very addictive. All the sugar and salt, it feeds the dopamine center of our brain and gives us that little dopamine rush, which is why we just kind of always want to grab for that piece of cake or that those chips, because they give us that little boost, that little good feeling. And so when we start to cut back on that, we start to notice that we can kind of feel down, feel a little depressed. But if we can push through that and manage those symptoms in other ways, then we can start to see the really good outcomes with our physical health. And then our brain will be able to clear up and we'll be able to get more natural sources of dopamine. So good candidates for GLP-1s are going to be individuals that have a BMI of 27 or higher, or if they are have an imbalance with their fat and muscle, where they have too much fat, not enough muscle. If they have weight-related conditions such as hypertension, diabetes, high cholesterol, those are all symptoms of a metabolic syndrome, where the body, all that inflammation is starting to affect the different parts of the body. You have to be willing to follow up once a week while you're on the medication, whether by phone or in person, and must be willing to inject the medication subcutaneously. So we want to inject it right. It's a teeny tiny little needle. It really does not hurt, but it's injected right in the lower abdomen fat or in the thigh fat. And it's a small amount of injection that's deposited there, that's going to slowly get absorbed into the fat layer there, and then into the body to help us control the glucose processing and decrease our appetite. So you have to be willing to self-inject yourself. There are some contraindications, people that cannot take these medications. They're not recommended for type 1 diabetics. They typically are going to need some insulin to really manage their diabetes. Pregnancy. One of the biggest warnings on the medications is certain types of thyroid cancer or familial family history of thyroid cancer. So if there's any indication of that in your family, you would definitely want to bring that to the alert of your physician. If the patient already has some kind of gastroparesis or significant GI issues, gastroparesis is where the stomach is already slow to empty. It's commonly a complication of long-term diabetes, but it can also be caused by other medical conditions. And if there's significant constipation to begin, then it must be proceeded with very, very cautiously, if at all. Gallstones can be a contraindication if they are untreated, because this can increase the number of gallstones and increase the gallbladder disease. And it's very important to note that if you are taking these medications, that if you're planning to have surgery, you need to stop them 2 weeks prior to surgery. The reason for that is because of the slowing of the stomach emptying. The anesthesiologists have just noted that with the stomach not emptying as well, when they go into surgery and the patient's asleep and they're going to put the tube down their mouth, that some of the stomach is still, some of the fluids and sometimes food in the stomach can come up and then can go down and cause a pneumonia. So we have to be very careful with that. So the way it works is we start out at a very low dose, and then we're going to keep increasing it little by little, so that we don't want to overdo it and make you sick at the beginning. We want to go very slow so that it's very tolerable, and then get to a dose where you're losing 2 to 4 pounds per week and you're tolerating it. You're not feeling sick. You're feeling pretty good. What we do here, and what I think is really essential with these medications, is to take a very comprehensive approach. Like I said, I don't believe in just putting people on this and just say, go, good luck, eat whatever you want. Some doctors actually have said that to patients that I've talked to: eat whatever you want. Just, take this every week. I think it needs to be part of a comprehensive approach so that we can really help our clients to have long-term success and sustainable success. And as we all know, it is so hard to change habits, right? Like, it's so hard. I'm always trying to get better with my habits, and it's quite challenging. But if we really believe that we can do it, and we really work on changing our thoughts, being mindful about our thoughts and our habits, and being committed to it, we can change our habits and develop healthier habits of diet and exercise. So we take a comprehensive approach. We really focus in on getting the diet dialed in, getting the plant-based diet, healthy diet, getting the processed foods out of our system. We start with a detox to really just kind of clear out the system, clear out the liver, get everything reset. We have a nutritionist that we work with if someone feels like they just really need some extra guidance and support. We also really encourage our clients to do some weight training. Muscle is the number one organ in the body for anti-aging and metabolism. So one of the best things you can ever do for yourself is to do weight training and build up your muscle. The other thing that we do is we start out with a very comprehensive evaluation of the patient, doing some very detailed and sophisticated lab work, which includes food sensitivity testing, which shows any certain foods that are causing excess inflammation in your body. So we can know specifically which foods those are, which ones we need to decrease or eliminate. We also look at micronutrient testing to see if there's any nutrients that are missing in your body that could be hindering your body's ability to detox itself and to create energy. We do weekly coaching, and we also use supplements such as the Akkermansia I mentioned prior, and some other key supplements that really help decrease the inflammation in the body so that the weight will be able to finally drop off. So that is a summary on GLP-1s, semaglutide, terzepotide. They're very, very handy tools. They are not a cure-all. They are tools, and used properly, used under medical guidance, and used as part of a comprehensive program to really reset our health and develop new habits, they can be very, very effective and powerful. I hope that this was helpful, and if you're watching on YouTube, I hope you'll like this video. Consider sharing it with someone that you care about. Please comment, ask questions. I'm always trying to keep up to speed on my questions. Let me know if you have any other topics you'd like me to discuss. And also check out our website, LifeSculptMD.com, where you can kind of learn about what we're doing as far as longevity medicine, primarily for women, with that foundation of intimate wellness and hormones. It's kind of a unique concept that I've developed over the years. Thank you so much, and I pray that God will richly bless you today.